Today's webinar focuses on consumer-led knowledge translation, how to leverage patient experience and networks to disseminate Cochrane reviews. Before we get started, I would like to thank you for taking the time to join us, and I'd also like to recognize the funders of Cochrane Canada, without whom these webinars, our training, systematic reviews, and capacity building could not happen. Thank you to CIHR and their institutes for their support. We would also like to acknowledge the Ontario Ministry of Health and Long-Term Care for their support. I'd like to thank PAHO, the Pan American Health Organization, for kindly providing us the Blackboard Collaborate software for our webinars. And a special note of appreciation goes out to Luis Gabriel Cuervo, who converts our webinars to YouTube videos. The recorded webinars are generally available online on the Canadian Cochrane Centre website under Education and Training. Without further ado, I'd like to introduce today's speaker, Mary Breheinus. After working as a physiotherapist from 1984 to 1996, Mary has been an active volunteer with organizations such as the Arthritis Society, the Canadian Arthritis Patient Alliance, the Canadian Institutes of Health Research, and the Cochrane Collaboration. Her current roles with the Arthritis Society include serving as an arthritis self-management program leader and master trainer, chair of the New Brunswick Division Advisory Board, and member of the National Board of Directors Executive and Mission Committees. Mary also served as a research ambassador for CIHR, Institute of Musculoskeletal Health and Arthritis Knowledge Exchange Task Force from 2004 to 2011, and has been a consumer leader with the Cochrane Musculoskeletal Group since 2004. She has undertaken several knowledge translation projects, including her work as a consumer collaborator on a team preparing a series of Cochrane reviews on the effects of exercise for people with fibromyalgia syndrome. She recently co-led a workshop with this team at the Quebec Cochrane Colloquium on leveraging patient networks to share the results of these systematic reviews. Mary is committed to bringing the consumer voice to health research and its implementation to inform health decision making by consumers, health professionals, and other stakeholders. So welcome, Mary.
Great. So it's a real honor for me to be here today, and I'm hoping that I can share with you some of my own experiences in knowledge translation, a little bit about what knowledge translation is, my experiences, and then to open it up to discuss consumer opportunities.
Could I just get you to speak up a bit, Mary?
In the
just
Cochrane
a tiny bit.
Collaboration. Okay, I'll try to speak up as much as possible. Thanks, Eileen. Yeah, no problem. So in terms of knowledge translation, it is a buzzword, and I'm going to spend a little bit of time talking about what it is and what it means in the context of Cochrane and health research. Again, a little bit about my own journey with CIHR, Canadian Institutes of Health Research, and the Cochrane Collaboration. So just moving into what knowledge translation is. Mind the gap, and we're not talking about a gap on a British underground place, but the gap in terms of healthcare and what it means. Generally, there can be up to a 20-year gap between new research and its implementation in healthcare. And during this time, where the evidence isn't informing the decision-making in healthcare, patients do not receive the best care. There are inefficiency in terms of health service delivery and suboptimal patient outcomes. And Dr. Ian Graham and Canadian Institutes of Health Research and others have referred to this gap as gap between knowledge and action, or the knowledge to action gap. So knowledge translation seeks to reduce this gap. And how does it do that? Well, let's just go back to the knowledge cycle at the very basic level. And if we start, my screen just, there we go. I'm going to get a pointer here. If we start here at the top right-hand corner of the knowledge cycle, we're talking about what research to do, what's relevant to the various stakeholders, including patients and the public, and the health practitioners who care for them. So the knowledge cycle will start here with deciding what research needs to be done, what is most important in this current climate, deciding how to do the research itself, whether it be a primary trial, comparing treatments, for example, or a systematic review that pulls evidence together, such as a Cochrane review, doing the research, letting people know the results, and then what are the gaps after the research is done, and then we go right back into the circle. And consumers can be involved in every point of this knowledge cycle, as outlined by the Australian Consumer Research PAC in 2004. Consumers can contribute to each point here in the cycle. Just move forward. And knowledge translation really is facilitating this cycle, especially not only letting people know the results, but that is certainly a key element in knowledge translation, facilitating the research and its implementation to reduce that knowledge to action gap. So this next slide really is the same as the slides before, although it's the framework, the knowledge translation framework introduced by Ian Graham in 2006, adopted by the Canadian Institutes of Health Research and many others. And I'm not going to go through all of this, but I'm just drilling down to a few really key elements here in the knowledge translation or knowledge to action framework. Beginning with this upside-down pyramid, where you start with the top element of the pyramid, of the knowledge creation pyramid, I should say, and that is the primary research that's done out there comparing treatments, for example, randomized control trials, and other studies that build the evidence base in terms of health. There's many studies out there of different quality and different approaches. So the next level, the knowledge synthesis, is what Cochrane does, systematic reviews, for example, where you pull together the evidence in any one question in medicine and health, and you publish a systematic review summarizing that evidence. So it's very valuable, but it's not always accessible to the people who need it. So that brings us down to the tip of the pyramid, the knowledge tools. So if you have systematic reviews, you need to package them so that they're accessible and in understandable languages for the stakeholders that need that information. So it could be plain language summaries, it could be a podcast, a webinar, it could be a video with authors sharing the results of the research. There's a variety of knowledge tools and products to package that information in user-friendly ways. So that's our knowledge creation pyramid. And as we get closer to the bottom, the evidence is distilled so that the high-quality evidence is produced and packaged for the audiences. Now then it brings us down to the circle around, the outer circle. And I'm not going to go through each of these steps, but basically it's the steps, the active steps that are taken to bring the evidence in a tailored way, addressing the audiences, the barriers for them, and the local context, so that it's usable out there by patients, the public, clinicians, policymakers, and other researchers, to be implemented around the circle, that the evidence implementation is monitored and sustained, to bring us right back again to the gaps, and then the knowledge creation back to the pyramid, and so it goes on. So basically this is the framework, and we'll move forward into talking about how consumers can help to facilitate this knowledge translation process. I've highlighted the center of the knowledge creation pyramid here because the work that Cochrane does, this is what we do. And consumers involved in Cochrane just have such a unique opportunity to make a difference in terms of sharing evidence, high quality health evidence with people to inform their decision making, and it's really it's a great opportunity for us. Bringing it back again to a more manageable way of talking about knowledge translation, I like to talk about this bridge in the middle here, and about the 4 different types of research on the left side, whether it be biomedical research in labs, clinical research comparing treatments, health services research looking at health systems, what's the best way to deliver the health care, and then in populations and public health on the bottom. So no matter what type of research we've got on the left side here, on the right side we've got our various audiences, such as our patients, our practitioners, our policymakers and healthcare managers, and then other researchers. And the stronger the linkages between the various parties and audiences and researchers, the better the better the knowledge translation approach can be. So it's about partnerships and strong linkages and active approaches to share evidence. This slide I obtained from Dr. Linda Lee, who's done a lot of research in knowledge translation and what's the best way to facilitate knowledge to action. And I like it. It's funny. We really need to do something with all this research. So at a basic level, that's why we're here today. So I'd like to talk to you a little bit about my journey and the way that I got pulled into the knowledge translation world. I was very, very fortunate in 2004 to be part of a really great group of people working with the Canadian Institutes of Health Research, Institute of Musculoskeletal Health and Arthritis Knowledge Exchange Task Force, that was founded by Flora Dell and Dr. Cy Frank in 2004. And I was invited to join as a representative of the Arthritis Society and Canadian Arthritis Patient Alliance to join this group. And basically, this institute does research in bones, joints, skin, oral health, and musculoskeletal rehabilitation. And so the institute approached voluntary organizations from across Canada who were working in these 6 areas, these arthritis, bone, skin, etc. areas. And each of these national organizations invited 1 or 2 representatives to join this task force representing them. So the idea was that we would bring that patient and public perspective from our communities to this institute to help shape the research priorities that were funded by the Institute, and then to help bring the results of the research to our communities. And so I was part of the group for about 7 years. This was our group starting out. It was just, I really enjoyed this, and I'll share a couple of projects that came out of the Knowledge Exchange Task Force with you. Phil Hughes, who was a retired teacher from Nova Scotia, was part of a Nova Scotia senior advocacy group, and they really looked at some pretty significant gaps in oral health care delivery in Canada. They partnered with the Canadian Dental Association to publish a paper on senior oral health, a system in decay. Phil was the author on the paper. They worked with Canadians and with in their home community of Nova Scotia to really bring attention to this, and were able to promote some better policy in terms of oral health care in Nova Scotia and beyond. And this was featured in a knowledge translation casebook in 2008. Really interesting story of bringing stakeholders together to make a difference. Some related activities were Phil and I and some other consumers joined forces with the Canadian Scleroderma Research Group, led by Murray Barron, Dr. Murray Barron at that time. And we really worked closely with the team to bring that consumer perspective that we were really learning through our Knowledge Exchange Task Force experience to their research team. And we were able to contribute to some grant applications that were successful with CIHR. And we actually were able to survey people with scleroderma to see what research priorities were important to them. And then we were able to bring some plain language summaries that had been developed by the Canadian Arthritis Network and the Arthritis Research Center in British Columbia. They had a very strong template for research plain language summaries. So we brought those to this team, and every one of their projects, they had a very well done plain language summary. And I'm not on the team anymore, but I looked them up today on the internet, and they're still going strong. They still have those lay summaries in the newsletters for their Canadian patients and others. So that was a really interesting project and very rewarding. Some of our research ambassadors went on to be founding members of national advocacy groups, including the Canadian Skin Patient Alliance and the Canadian Osteoporosis Patient Network, both of which are still active in Canada today and really making a difference in terms of advocacy and Canadian policy and practice. I'm just wondering if there are any questions at this point and if you can hear me. So how about if you jump in with some smiley faces if you can hear me okay and are following so far. Okay, thank you very much. So the next Knowledge Exchange Task Force activity that I'd like to share with you was a partnership with the Cochrane Musculoskeletal Group. And so this goes all the way back to 2006, and it actually, I'll bring you right up to 2014. It was some of the projects that we've done since then in this same theme and with the same people, some of the same people. So our Knowledge Exchange Task Force partnered with Cochrane Musculoskeletal Group in 2006 to share the results of Cochrane reviews, musculoskeletal Cochrane reviews. So our group, our small working group, 5 or 6 of us, we were each asked to select a recent Cochrane Musculoskeletal Review group, Cochrane Review, to share broadly with an audience. So there was a team out of the University of Saskatchewan led by Dr. Angela Bush that was preparing an update on fibromyalgia and exercise review. So they were investigating or synthesizing the evidence on the effects of exercise for fibromyalgia symptoms. And it looked like they were going to have some messages for patients in the public. So we adopted that audience. And we thought that this was a message that we could share and that would be something that patients could do themselves with their health practitioners to make a difference for them in their lives. So we selected the Fibromyalgia and Exercise Review, the target audience of patients in the public. We created a poster, and we had touched base with the Arthritis Society and some other national networks to help us share the results, and we were going to provide a link to the lay summary of the review lay summary and the Canadian Physiotherapy Association Smart Walking Guide, which was itself evidence-based. So that was our plan. However, before the results were published, just before the review was published actually, there was a revision, and it looked then that the results were not as significant as we had anticipated they would be. And it can be the final message in some reviews and some studies. So we thought, okay, do we go with this message, or should we switch our target audience to try to address that gap, which really was that there wasn't enough evidence yet to share, and we didn't know whether exercise made a difference. So what we did was we switched our target audience to other researchers, and we packaged the research gaps that the authors of the Cochrane Review on exercise identified using the British Medical Journal framework that the editors of BMJ recommended that authors use the EPICOT acronym. It's PICO with an E and a T on either end, really. So using EPICOT framework to summarize the research gaps, we worked with the authors on the review to do this. So this was our table. And then we shared this table as widely as we could with the research community, both nationally and internationally. And then we summarized the process, and we were invited to publish this in Physiotherapy Canada as a guest editorial in 2009. So that was our project. We did do a survey among this audience, the research audience, to see whether this was of value to them. And it was very small, but we did get some feedback, and the results were quite positive actually, and it had influenced research direction in a very small way. It was a small project, but it was interesting and fun. And then what we did was we were invited by the author of this team to join their team, a few of us consumers, as collaborators on the actual review team. So that's what we did. A couple of us joined as collaborators, planning for the next set of Cochrane Review updates in this topic. One of the consumers, there were 2 of us, wasn't able to continue, and in 2011 we went to the Cochrane Consumer Network, and we invited interest we were looking for one more consumer, and we actually had quite an uptake from the Cochrane Consumer Network. We had about 10 applicants very quickly, and we were able to select Janet Gunderson, who was very interested and has arthritis herself, and is based here in Canada. So she's been with us ever since. And basically, the process we've gone through as consumer collaborators on a Cochrane systematic review team is that the author has been very welcoming, and the team has been, and so we're full participants in terms of team planning, the regular meetings we've been having every month. We have been particularly involved in selecting review outcomes with guidance of national consensus guidelines on outcomes in fibromyalgia. And we met with a local support group here in the community I live in, and we gathered their feedback on outcomes important to them. And so we've made quite a contribution there, I understand. And our team is basically producing a systematic review now on each type of exercise, beginning with resistance or strength training. We published in December. And then the upcoming reviews will be on aerobic exercise, flexibility exercise, aquatic exercise, mixed exercise. And then after that, we're planning to publish an overview of systematic reviews. And again, this is a team led by Dr. Angela Bush out of Saskatchewan. We've been involved with also the plain language summaries, making sure that they are meaningful to patients, following Cochrane guidelines. And we've been particularly involved in the knowledge translation side of things. And so we have, especially with a series of reviews that's going to include an overview of reviews, and our evidence is looking that we have some good messages to share that fibromyalgia can make a difference in terms of managing fibromyalgia, and looking at what types are best. So I'll just tell you a little bit about this project. So basically, our two main audiences for our Cochrane reviews are consumers or patients and clinicians, practitioners. So in terms of our first target audience, we used the 2013 Cochrane Colloquium in Quebec to hold a workshop to meet other stakeholders for their feedback on the best way for us to share our review results with patients with fibromyalgia via established patient fibromyalgia networks. These groups are very well established throughout the world, both national organizations, international organizations, with strong linkages to communities. And a lot of them have quite strong social media presences, such as huge Facebook followings with tens of thousands of people following them. So we've really got some strong networks out there, and we've met with a couple that are very interested in helping us share our review results. And there's much more potential for us to reach further into, further afield, I guess I should say, through the network. So in Quebec, we had two groups of 8 participants in our workshop, and we used a nominal brainstorm technique for people to generate and rank their ideas and ways for us to share our review evidence with patients. And basically, our main results, it was a very interactive and lively discussion. It was great we had people from around, from different places. We had people from South America, Africa, and several other places internationally. And the main messages that were that we needed to use a variety of knowledge tools so that we could reach different audiences, looking at different culture, different language. In Africa, we were encouraged to use things like apps because cell phone use is very common and heavily used. South America, there was an effort to use a little bit more radio because that is more heavily used there. So we had lots of ideas. I'll give you some more specifics on that in a moment. So that was to share evidence directly with patients. The other key aspect there is that we need to share our evidence using a variety of knowledge tools as well with practitioners, physiotherapists, trainers, for example, physiotherapists, trainers, physicians, so that to inform their clinical practice, but also in a way that they can share the evidence with their patients. Patients often don't know which evidence refers to them or applies to them, and they don't know about trustworthiness of health evidence, especially online evidence. So there's a real need to share it directly with them, but also to share it with them in a way that they can, in a way to facilitate shared decision making, such as the patient decision aids that Anne talked about last week. There was a recent Cochrane review on decision aids just recently published by Don Stacey and team, and I believe I've got the reference there at the end of this presentation. So going back to some of the specific tools that were recommended, plain language summaries, they go with all of the Cochrane reviews, so that's a good one. Although we were encouraged to use online networks, for example, we certainly are aware that not everyone has access to the internet, especially seniors, and that we need to reach them in different ways as well. So print materials, mass media, digital media, blogs can be very, very useful. Social media, we've got a team meeting next week, and we are going to start to share our resistance manuscript, which has already been published, some key messages on Facebook and Twitter feeds of some of our national partners, and then we'll see what happens with, well, we'll evaluate it as we move forward and publish our next reviews. So in terms of what we're going to do as a team, right now we don't have any funding for knowledge translation activities. So some of our plans as we move forward are that we plan to organize and begin and develop a designated team, fibromyalgia and exercise, website or blog, we haven't decided yet, but as a resource for people to come and see what the evidence is. And so that's a big step for our team. It's a busy team of researchers and clinicians and consumers, so this is a big step for us, but it's important. And we can link right back to this blog and website with our key messages and other knowledge tools. In terms of our other main our other main audience of practitioners, we're considering having a similar engagement process to get further feedback on the best way to share our evidence with clinicians, starting with physiotherapists. So we're looking at some potential grant funding. Just out of interest, we've had some very interesting media interest in the first manuscript we've published. We had a reporter from South America, Brazil, who we were able to work with to get some magazine. It's a major health magazine in Brazil, so our results will be summarized there. Medscape, which is a website that has a large following, we have a summary on their website now. And we're going to, as I said, we're going to start exploring the social media worlds of our networks with our resistance training review shortly, and then we'll move into our other reviews and build from there. So it's definitely a work in progress. We're unfunded so far, but the principal investigator, Dr. Bush, is incredibly open to this process and indulges us a little bit, I guess. But it's been really fun, and we don't know yet how far we'll go or where we'll really end up, but we are taking it one step at a time and building. It's exciting. It's fun. It's been a real honor. So just touching, for me personally, it's opened doors for me in my life. I'm much more confident in terms of my own health care. We try to bring some of this enthusiasm out of CIHR and Cochrane to some of the work we do with the Arthritis Society and some of the other organizations here in Canada that are really supporting research. Now, this has been my experience, and there's so much good work going on around the world in knowledge translation and consumers. And the Cochrane Consumer Network is leading the way. They've got a number of platforms and ways that they share evidence and promote research and knowledge translation. I was on their website just the other day. There's some excellent videos there with consumers talking about some of their work with policymakers in various countries around the world. It's very impressive, and there's some very good work going on there in terms of knowledge translation. Being based here in Canada and being part of the MSK community, I've been particularly involved with Cochrane Musculoskeletal Group. They've done a lot of work in this area. They've involved consumers in prioritizing reviews, as Cochrane Consumer Network has done that as well. Tamara Rader and her colleagues at the review group just published a very, very good paper on knowledge tools for the 5 P audiences: patients, practitioners, policymakers, the press, and my brain is freezing here. There's another one there. And I've got the reference at the end. Cochrane Consumers and Communication Group does a lot, and there's lots of other knowledge translation activities within the collaboration. So basically, I hope I didn't rush too much, but I really wanted to come to this very last slide about what, where can we as consumers bring our voice, where can we strengthen our voice, and where can we bring new voices to the Cochrane collaboration in terms of helping to facilitate the knowledge to action cycle and reducing that gap and informing decision making by all stakeholders, including patients. So I'm going to open that right up to you and invite questions.
Okay, thank you very much, Mary. I know that you have a list of references as well here for everybody to take a look at afterwards. Before taking questions, and while questions are coming through, I'd like to mention the upcoming webinars next week. We have a webinar on navigating the healthcare information jungle, and this session will explain how to identify high-quality healthcare information, as well as provide tips to identify reliable sources of evidence-based information. I know that we have people from all over, not only the country and the continent, but globally. And if anybody's got any questions for Mary about perhaps consumer involvement, how to maintain the momentum of consumer involvement, and actually strengthen that involvement.
If there's anything too that you'd like me to expand on, because I realize I went through the slides fairly quickly, and I want to make sure that I'm meeting your
I believe somebody raised
today.
their hand. Is there, perhaps you could type that question into the chat room? That would be appreciated.
One element that I hadn't mentioned is that there are some very good health information websites out there, like Medline Plus and PubMed Health, and those type of NHS Choices, for example, and those are potential areas for us to partner with to also get our evidence out there. So that is another way that we are considering sharing our review results via those already
we do have a couple of questions coming through here, Mary. What are your strategies for recruiting appropriate consumers?
Okay. Oh, that's a great question. Well, we were really fortunate with when we reached out to the Cochrane Consumer Network in 2011, when we had the other consumer that had joined the Cochrane review team with me. So we just summarized the tasks and the objectives of the consumer involvement and the ways that, I guess the roles would sum it up. So we summarized the roles, the team consumer collaborator roles, and we shared it via the Cochrane Consumer Network listserv. And it wasn't 24 hours before we started getting emails. We had a number of them, and we asked, we had a few questions for them to tell them, to tell them us about themselves, I guess. And so we basically reviewed the applications and very quickly were able to invite a consumer. So for us, the Cochrane Consumer Network was a really good place to start. I believe that the Cochrane Musculoskeletal Group has done quite a bit of work with some of the patient groups in the musculoskeletal field, both in Canada and internationally, to approach those organizations for patients that are interested in working in research, and then to invite them to join in. I think the main requirements are really the interest and the commitment to be part of a team and to try to bring that patient voice to the team. So that's what we've done. I think the Cochrane Consumer Network, if you were looking for a consumer, would certainly be able to help you specifically with that as well. Catherine McElwain, I think, is the CCNet.
Okay, thank you, Mary. We have another question. Beyond plain language summaries, were there other ways to address health literacy and healthcare terminology? That's the first question. And then, was this a barrier at any point in the process?
Yeah, and that's a really good question. And we talked about using a variety of formats because there's different cultures and different languages, etc. But really, there's different literacy, health literacy. Everyone is different, and not everyone, has strong health literacy. So, I've been able to read some of Angela Coulter's work on patient engagement, and she says that really all health evidence sharing should aim to improve health literacy. So, we've talked about using multimedia kind of approaches so that there wouldn't be so much of a reliance on the written word, but other types of things like animation, for example, and humor, and ways to, especially with an exercise review. So there may be some, as we move forward, especially once we get that overview, because we'll really, really have strong evidence, and we feel it'll be really worth sharing. So we're hoping to get some funding to help us perhaps bring in a knowledge broker, for example, who can work with our body of evidence, our research team, to help bring the evidence to people in understandable ways, and that would be for people with all levels of literacy. So that's got to be a goal, I think, to make sure that we're not missing those underserved kind of populations who are vulnerable. So literacy is definitely a consideration, and I think it demands more than just a written word.
Also, we've been asked, what challenges did you have in this project on knowledge translation? I think you certainly mentioned funding too, which always comes up. And would you like to share those challenges?
Well, I think for us, because we're a small team, Janet and I are both volunteers. The team is we're all volunteers, but there, we only have limited resources. We've got big ideas, but so really, we keep having to pull ourselves back, I guess, and say, okay, we're not a research program, we're a research team. So what can we really do, and what's really realistic? So I realize that we're kind of, at times it feels like we're pie in the sky, but then we really need to pull ourselves back and say, well, what are our resources? What can we feasibly do? But certainly there is money out there in knowledge translation. It's a big and growing focus because of that gap. So we are hoping to get, if some funding, then we can bring in some reinforcements to address that barrier. We also, the Cochrane Musculoskeletal Group often has summer students, and there has been an offer made that we can access some of her or his or her time this summer to help us, for example, get our blog going. So I would say the biggest barrier for us so far has been
another question
resources.
came in. I really liked how you switched to creating a briefing for researchers when the evidence was lacking. How do you see that initiative building?
Well, that's a really good question. So, and I'm not sure I completely understand it. So we pulled back, and we pulled back to see, well, who is this message really for? What are we trying to achieve? Looking at the knowledge translation cycle, if we don't have the evidence we needed, then we need to address that gap. So that brought us to that research audience. Certainly, I think it was a matter of resources. I think that piece of the project certainly could have been further developed and further shared with additional resources to the research community, and we could have had a broader impact, and then we could have evaluated it more fully. So again, I think it's the resource piece that made it
it's always
made it
resources,
a small
isn't
rather
it?
than a larger
Yes.
project.
We do have another question. Do you have much to do with Wikipedia? I always wanted to go to that website if I don't understand medical jargon.
Well, that's a great question. I'm not an expert here at all. There was a Wikipedia. I believe there was a presentation in Quebec. I didn't get there. There were some people. There seems to be increased interest within Cochrane to work with Wikipedia, and I personally think it's a great thing because people go to Wikipedia, and I had mentioned before PubMed Health and Medline Plus and NHS Choices and places like that people already go to. So that represents a huge potential for us to make sure that our strong, good evidence is getting to places like Wikipedia, where a lot of people go, and we don't have to work to get them to go there because they already do. So I support that, and my understanding is that Cochrane is working with Wikipedia to build this kind of partnership.
I was just going to say, I was just going to say that I agree with you. I know that there was a session that I think added more depth to the knowledge about what they were doing at the colloquium. I as well wasn't able to attend that, but I do know that there is a partnership happening between Cochrane and Wikipedia, and they're certainly hoping to develop a wiki page for Cochrane.
It's exciting. I think it's exciting times to be part of this, and I mean, for me, it's been I really think this KT piece is fun, but I feel that there's a lot of potential for consumers to become involved, and I'd really, if there's any review authors out there, as consumer collaborators, I think that consumers can really help to share that evidence, especially with the lay audiences. So it's an exciting time to be part of this effort because knowledge translation is growing, and Cochrane is really looking outward.
Mm-hmm.
As this webinar is a great example, actually, of that.
Now, there is another question here, too. Can any research group or team across the Cochrane Consumer Network, can any research group or team access the Cochrane Consumer Network listserv?
I'm not sure of that answer. I believe that it's certainly open to anyone. So, I mean, in terms of joining the Cochrane Consumer Network. So, I think if you wanted to connect with CCNet, go to the website and contact Catherine McIlwain about.
I think as well it depends what Robin means by this. When you mean access as in join as just a participant receiving information, or do you actually mean access as in be able to use that listserv for say for something in your specific research group? I'm not quite sure. I think Robin is kind of clarifying that for me.
Okay. I wonder if Anne is on.
I didn't see her
on the webinar. If she
let's see. Okay, so she actually has clarified.
Question.
She says to be able to use the listserv
to
invite consumers to participate in your research. That's something I'd have to check about. I'm not certain about that because that is like a recruitment issue, and then there are a bunch of privacy issues involved in that. So I can't say for sure, but I could be able to find out for you. Well, I'm going to take this time to say thank you very much to all of you for joining us, and thank you so much, Mary, for your presentation today. We could give Mary a round of applause. Thank you. Thank you.
Thank you, everyone, and thank you so much, Eileen.
Bye, everyone. Hope to see you next week.
For inviting me today.